All right, well, here we are. We are at module two. Just got to make sure that I got this thing going. Okay, good. So we're on module two now. In this module, we're mostly going to be looking at what we call the four principles or the four foundational pieces of motivational interviewing. And you can see right there on the slide, those are expressing empathy, supporting self-efficacy, rolling with resistance, and developing discrepancy. We're going to go through each one of those and discuss them, discuss how they fit within that spirit of motivational interviewing. And then we're going to look at another comparison example of a physician helping a patient look at tobacco cessation options. And that will provide a nice opportunity to see, how the spirit of motivational interviewing is, kind of fits and weaves its way into a conversation and into the techniques, and then it will also provide you a chance to see some of those techniques. So I love that comparison as well. So let's jump into it and take a look at the very first principle, foundational principle really, which is expressing empathy. So human to human, can we appreciate the circumstances that our clients are in? In a live seminar once, I heard a person say this, and I just loved it. They said, we all started out as children coloring in the same coloring book. And, how awesome is that? It's true. We all were in the same place. We all started from the same place. And then because of environmental factors, because of differences, we've had different experiences throughout the journey that we've been on, and that lands us in different places. Empathy is my ability to appreciate where they've come from, the challenges that they've experienced without me necessarily having to be in that exact situation. So I go back to the example of a person who's on court mandated treatment, right? And kind of reviewing what that process is. So putting myself in their shoes, I look at, here they were engaged in a behavior, whether it's substance abuse, some criminal type of behavior, and you could spend all day talking about why they were in that place, the disadvantages that they were facing, the challenges, the environment that they were in. That could be a conversation for a whole other day, but for whatever reason, to survive or to meet a need, they were engaged in a behavior that society finds illegal. So law enforcement is involved, they show up. Those exchanges are not always peaceful ones, that person may have ended up with their face in the pavement, and being handcuffed and put in a patrol vehicle and hauled off to jail. So now here I am at jail. I'm in a cell. I have a bathroom that's just out there in the open for everybody to see, and my privacy is completely gone at that point. So that would be extremely frustrating. And then where do I go? So then I go to court, right? I see this judge. I don't know them. They don't know me. I have no history with them. And yet they're determining my future. They're determining what's going to happen to me, right? And what I have to do to make up for whatever criminal behavior I was engaged in. So at that point, perhaps let's say I'm assigned a probation officer, right? And I might be thinking, well, this glorified babysitter, I now have to do whatever they say. I have to be home when they say I have to be home. I have to, they determine where I go and what I do with my day. And so that can feel pretty punitive. So then this probation officer says, you got to go meet with this shrink or this therapist or whatever. And I'm thinking, great, I'm going to go sit down and have a total stranger tell me all the things that are wrong with me, right? So if I can kind of put myself in the shoes of some of my clients, I can appreciate the struggles that they've gone through, right? And empathy really gives me the ability to feel for that, right? I don't have to know what that person is going through exactly, but I can find something within myself that can tap into that feeling, right? I have, say I've never been on probation before. But I can tap into what it's like to feel controlled. I may have never been to court before, but I know what fear is, right? I may have never had to have gone to therapy before, but I know what being vulnerable and exposed is. Okay. So, so I can tap into that feeling, and that's really what this goal of empathy is tapping into this feeling and appreciating what that person may have gone through. Okay. Now, empathy is on the complete opposite end of the spectrum from blame. Okay. There really is no room for blame when we are building and developing this therapeutic relationship with our clients or our patients. There's no point in blaming them for where they're at. I come from the place of everybody is simply doing the best they can with what they have. And the sad reality is not everybody has the same platform to jump off of. And so for me to blame, there's really that is a super counterproductive way to go about my work with a client, because all that's going to do is drive division and create division between myself and between them. So I have this video right here. It's you good chance you've already seen it. Brene Brown, she's a rock star. We're going to take a look at her video of empathy versus sympathy and see if we can't just sort of put into one word what motivational interviewing is all about. So here comes the video.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
All right, so I love how Brene Brown put that right there. She said that kind of the 4 parts of empathy are perspective taking, being able to appreciate where that other person's at. Staying out of judgment, that's really hard to do. And it's hard to do that in an era where there's social media and there's so many opinions available on the web and everywhere. It's hard to stay out of that place of judgment. It's also the ability to recognize emotion in other people and finally to communicate that emotion. Like we've already stated, we don't have to know exactly what a person has gone through in order for us to connect with some part of that, right? It's the emotion behind it, it's the struggle behind it. We've all struggled, we've all gone through different challenges. We can connect with that without having to completely and fully understand where the other person is coming from. Empathy really gives us the power to allow ourselves to say, help me understand where you're coming from, and help me understand uh, you know where you're coming from the perspective of culture, from the perspective of race, from the perspective of environment, whatever it may be. This is an opportunity for me to learn, and this is an opportunity for me to connect with that person I'm working with, regardless of their walk of life, and where they've come from. So, what is MI about? Honestly, if I could sum MI up into one word, it would be this: connection, right? Therapeutic relationship is about connection. Do I feel this therapeutic connection? Are we partnering? Are we in this together, right? Or is there some imbalance in my effort to help the client make the necessary changes in their life? And so I can use this connection to kind of help me gauge and understand where we're at. Now, we could get into a whole ethical conversation. I oftentimes do about this connection and this therapeutic relationship, and how that plays out with the ethical code of our professions. I'm going to trust you to know what that is. A therapeutic relationship is when I am doing something for the client without any benefit for me. That's how I see that. But I'm going to invite you, if you're not sure about how that all plays out, to go back to your ethical codes to help you make those decisions. All right. So the next principle is supporting self-efficacy. So self-efficacy, this is my belief in myself, kind of like my self-esteem. All right. Now, what role does self-esteem have in motivational interviewing? Well, think about this. Everything I do because I'm hoping for something, right? I brush my teeth every day in hopes that I don't have cavities, right? I plant a garden in hopes that it's going to produce vegetables and fruits. Go to work with hopes that it's going to allow me to provide for myself, provide for my family and my loved ones. Everything I do with hope. And so if we remove hope from the equation, what is the purpose of any of our clients trying something different, trying something new, right? What's the point in them exploring change if there's no hope? So we want to identify the self-efficacy that our clients have, but we also need to identify the self-efficacy, or I guess just the efficacy that we hold for our clients. Do we have a hope for them? Do we believe in them, and have this hope for them that they can make changes? Now, we need to be careful here, because sometimes my hope can be maybe greater or grander than what the client has hoped for themselves. So again, remember, if I'm being client-centered, I really want to make sure that I am not letting my own hope kind of supersede the hope that they have for them. But everything we do with hope. Kind of an illustration of this in my mind is I live in the Rocky Mountains, and I enjoy hiking. If you've hiked in the Rocky Mountains, you know that you are rarely hiking across level ground. Usually you are either gaining or losing elevation when you're hiking in the Rocky Mountains. And I can think of a number of times where I've gotten to a trailhead and I can see up somewhere, and it's like, oh man, we gotta get up there. That's where we're going. You put your head down and you start going, and and at some point you look back and you see how far you've come. Maybe you can see the trailhead clear down there. but you have this moment where you're like, oh, I really come pretty far, right? And that's where we're trying to get with our clients. We're trying to help them build this belief in themselves by helping them see how far they've come and by making that tangible. We're going to talk a little bit more in the third module about how we help them do that. But hope is important. Hope is important for our clients. Hope is important for us as professionals to help build that hope and that belief for them. All right, the next principle is what we call rolling with resistance. This is probably, of all the principles, the one that gets the most recognition, uh, because it's a key piece of how we deal with those difficult moments, right? That our clients may have. Remember, they are those natural, normal, predictable behaviors that our clients sometimes have when they're in a situation that they don't necessarily elect to be in, right? Which, uh, I'll be honest, I don't think anybody would elect to come to me if they could help it. That's kind of depressing. Um, but rolling with resistance is the ability to help kind of overcome or not get into the frustrations of the client. So let's say I have a client. Well, I can give you an example. I had a client years ago. We were doing a group, and she was court mandated. The first day she came in, she put her head down on the table and was like saying, "I'm not participating." And it was like, okay, everybody today, everybody gets to stay awake during class, right? The next week she came in and she brought into class with her. It's like, hey, everybody, what if we all agree to no puppies in class, right? And then the third day that she came in, she brought her baby with her. And it was that same conversation. How about we don't bring our babies into the group? Now, the thing is what she was doing was resisting the whole idea of being in group. My response to that is really important. Okay, I need to make sure that I am not taking that personally, that I'm not getting defensive, that I'm not becoming judgmental of her, and that we simply roll with those bumps and those hiccups and just make it, just make it known in a consistent way, that that's not something that we're going to be doing. Okay. Now, remember, people usually resist change when it's something that they're required to do, right? We probably all feel that or have felt that at some point, okay? It's in our nature. It's important to remember that resistance is not usually a personal attack, okay? It could be, but a lot of times it's not because it's something that I am doing. And so a training friend of mine years ago shared this idea with me. You remember what we were taught as kids, what we're supposed to do if we catch on fire, right? If we catch on fire, we're supposed to stop, drop, and roll, right? So let's put this in terms of resistance from a client. So let's say a client says something at me in a group or individually with a lot of anger, a lot of emotion. The first thing I need to do is I need to stop and check myself. Make sure it's not because of something that I'm doing. Am I being judgmental? Am I being unsafe? Um, am I doing something that's outside of that spirit of motivation? If it is, I need to change that. If not, then that's the next step. I need to drop my defenses. I need to drop my tendency to take it personally, and I need to drop my desire to be right, to be the expert. So I need to stop, check myself, make sure it's not something I'm doing. Drop my tendency to take it personally, to want to be right, or to become defensive. And all I do at that point is I roll with it. Okay, I roll with it. Client brings a puppy to class. Hey, everybody, today we're just not going to have puppies in class. All right, if you have a puppy, please call your friend and have them come pick it up. Okay. I'm not talking to anybody specifically, but and so that's the goal here is we roll with that. It's kind of I think of like a duck. A duck is amazing. If you've ever seen a duck get wet, that water rolls right off of its back. And that's what we're going for here. We want that resistance to just roll right off of our back. Okay. That resistance truly is an opportunity, because if a client is coming in and they got their dukes up and they're ready to fight and they say, I don't have a problem, and we're like, you betcha you do, right? And then we got this big battle. But what if they came in and they said, I don't have a problem, and we say, okay, that's fine, tell me a little bit about why you're here, help me understand. We can really use a person's resistance to develop that therapeutic relationship. And again, we got a whole module set aside for reflections and reflective statements. But a really great technique is to roll with a reflection, managing that resistance. Okay, the next goal or the next principle of motivational interviewing is what we call developing discrepancy. Now, in developing discrepancy, the goal here is not for me to tell them what they're doing wrong. Okay, I'm not wanting to say to them, what were you thinking? What's your problem? Couldn't you see that if you did this, the car would end up in the ditch? That's not the goal here. Truly, the goal is to help them recognize where they're currently at and where they want to be. And there's a lot of really great techniques and skills to help them do that, which we'll cover in the evoking section. But remember, if we remember that lasting change is self-change, their ability to take ownership of that change will be so much greater if we allow them the autonomy to process through that, to chew through that, and instead of us saying, here's what you need to do, then we say, hey, what do you think you could do about this? What do you think would be the best way to handle this? And kind of guide that conversation instead of just dictating to them what they need to do. Now, the default is we always want to give them the first opportunity to resolve their own challenges. But there are times and situations where we do have important information to share with them. We do want to share that information with them. And we actually we have a formula for how to do that, right? I don't mean to keep kicking the can down the road, but that will be covered in a future module. So those are our four goals, right? The expressing empathy, supporting self-efficacy, rolling with resistance, and developing discrepancy. All of these are kind of really the foundational pieces of what we're trying to accomplish as we're working with our clients, and they are the overarching principles in terms of that spirit of MI of how we're operating and what kind of clinical environment we're wanting to create. The worksheet that we're going to cover today, we'll actually look at in a little bit, but the worksheet that we're going to be covering or that we're going to be doing for this module is going to be giving us a chance to practice identifying some of these different principles. So I love this right here, this piece on developing discrepancy. Ken Resnickow, and I got to be honest, I apologize if I slaughter their name, but the way that they put this, I love. There you can see in underlines, it says that the essence of motivational interviewing is to comfort the afflicted and afflict the comfortable. And I absolutely love that. People come to us, they're hurting, they're suffering. We have an opportunity to help them through that healing process and to support them. And yet at the same time, we also have people who come in who are very resistant to the idea of change. They're very much in a kind of pre-contemplative state. And we have the opportunity to just apply a little bit of sizzle there, just a little bit underneath, so that they can start to recognize that things kind of need to change, right? I probably do need to cut back on my drinking a little bit, right? Or whatever it may be. We want to both comfort the afflicted and afflict the comfortable. Not that we're trying to push anybody overboard, just help them recognize the importance and the need for it. Now, the way that we do this is in a very MI consistent way. We draw alongside with them, we connect with them, we help them identify the discrepancy between where they are and where they want to be. Okay. I cannot say this enough. We are not trying to fix anybody. Remember, if we try to fix them, we are going to likely create some resistance, and the likelihood that they're going to follow through with that is less. Our goal is to really help them find their own solutions of how they can change their circumstance so that they have ownership of that change. Now, there's a couple things that motivational interviewing is not. All right. So, first of all, it is not confrontational. Look, this is not break them down so we can build them back up therapy, right? Um, One of my first clinics that I worked at, this was years and years ago, they had a 40% success rate. And they really had that kind of old school, break them down so we can build them back up kind of mentality. It's how they ran the clinic. They had a 40% success rate. Now, here's the thing. By success, they meant the number of people who completed treatment. That does not include people who completed treatment but really um, never made significant improvements in their life. We have MI consistent programs now that are in the 90th percentiles in terms of measured change and measured improvement, 6 months down the road. And so we can really see that when we have an MI consistent way of working with folks, that we can see lasting change. But we're not using confrontation. We are not being hostile. We're not blaming, demanding, prescribing, or commanding. We're not doing any of those things. The other thing that we're not doing is we're not being wishy-washy, right? Motivational interviewing has a clear direction, our directional objectives, what we're trying to accomplish, where we're trying to go. We want to help our folks get better. They're not just coming into our clinic and then we're talking blah, blah, blah about, so what did you do over the weekend? What do you think about this weather, right? That's not what we're wanting to do. We have a very clear purpose and objective for why we're meeting, okay? The other thing that it's not is it's not touchy-feely, right? We talk about a therapeutic relationship, but this is not a relationship in the traditional sense, right? I'm not becoming personally intimate. I'm not becoming friends. I'm not going to their kids' soccer games. I'm not taking on this parental role for them. I'm not being touchy-feely. I'm still maintaining my ethical obligations as a professional. And so we need to be mindful about that. What am I getting anything out of this relationship, this therapeutic relationship? Because if I am, for me personally, this is just me personally, I believe that is going outside of that therapeutic. So these are a couple of things that motivational interviewing are not. They're not confrontational. They're not wishy-washy. They're not touchy-feely, right? We have a purpose, we have an objective, and we're getting places. All right. Here's a couple of things that we do see sometimes in motivational interviewing, or not even MI, but just in a clinical interview experience. We do see some confrontation. That confrontation creates denial. That denial creates brick walls. And then it's really hard to help a person feel willing to explore alternatives to what they're currently doing and to be vulnerable enough to explore that change. The other thing that it's not is we're not being the expert. Look, I know that we have a lot of nice licenses and degrees and all kinds of fancy things around, but we're not playing the expert role, okay? We're being somebody that they can connect with. We're being somebody that empathizes for their situation regardless of what it is. We're not labeling them. I think that labels are really important, because whatever the behavior is, that does not define the person. And how can we help them build self-efficacy if we're focused on what they're doing that's wrong and we define them by that thing, right? Like one thing I hear a lot, like on the radio, is that, a smoker, right? Well, these, if you're a smoker, blah, 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 blah. Well, you know what? There's so much more than that too, you know? And that, you know, it's like they are a person, they are a person with inherent worth that also does this one thing that needs to change. But so much of them is good and great and wonderful and doesn't need to change. And we lose that when we focus on our labels. Now, the next one is what we call the premature focus trap. This actually ties in really nicely with stages of change. And so the stages of change research by Carlo Di Clemente, he went through these different stages: pre-contemplation, contemplation, preparation, action, and maintenance. Talks about phased intervention in there. And what that means is if I try to address a person or work with a person in a stage of change that they're not in, I could actually do more harm than good. So for example, let's say that somebody's in pre-contemplation about changing their diet, but I'm trying to write them a new diet plan. I could potentially totally shut down their idea or their openness to a new diet because it's feeling forced and it's like, well, you have to do this. And so I want to make sure that I understand where the person is. Again, that goes back to being client-centered. I want to understand where they are so that I can meet them where they are and address the needs of whatever stage of change that they're in. Now, we already talked about this one a little bit, blaming, right? There really is no place for blaming in an MI consistent interview. That just really tears down that therapeutic relationship. Is completely destructive. And then the next one is the question answer trap. Now, one of the techniques that we're going to learn is going to help us avoid that question answer trap. I find that a lot of times we get into this question and answer trap when we are using a lot of closed-ended questions. Of course, if you have any experience with MI, you know that open-ended questions is definitely the majority of what we're looking for here, because that provides such a greater wealth of knowledge and understanding that I can kind of stay out of that ping pong back and forth. You know, do you want to change? Yes, I do. Are you going to change? I don't know. You know, and that back and forth. And so we really want to make sure we're careful. So with all that being said, let's go ahead and take a minute and look at this example that was produced by the University of Florida. I think this is really interesting. It was funded by the Flight Attendant Medical Research Institute. But it's a great comparison. So we're going to look at the same situation just two different ways. This is a physician working with a single mom regarding tobacco cessation. In the first example, we're going to see it's a very non-MI consistent experience. And then the second video is going to be far more MI consistent. You're also going to get to see some of these skills and techniques, kind of a preview before we jump into those in the next module. So go ahead, enjoy this, take notes. We're going to kind of process a little bit after the video is over. All right? So I'm going to hide myself again so you don't have to have me staring at you watching the video. And here's the first example.
Watch what happens as this provider becomes more and more confrontational in her warnings about tobacco use and her advice to quit smoking.
Okay, so I wrote a prescription for an antibiotic for Aiden that should help with the ear infection, but in looking through the chart, I mean, it seems like he's had 6 or 7 of these just in the past year or so.
Yeah.
That's really a big problem.
Yeah, it's pretty stressful for both of us. He gets really upset.
Well, one of the primary risk factors for multiple ear infections in kids is actually smoke exposure. Are you smoking?
Yeah, I do smoke, but I don't smoke around him. I try really hard not to smoke around him.
Well, the fact that he's having these ear infections is indicating to me that he is being exposed to smoke. And so what can you tell me about that?
I don't know. I mean, I try really hard not to smoke around him. I don't smoke in the car. When he's home, I go outside to smoke. I know it's bad, and I know it's bad for him, so I don't want him to be around it, so I try really hard.
I really need you to quit smoking, both for your health and for Aiden. Did you know smoking around your child is associated not only with ear infections, it could get to the point where you have to put tubes in his ears pretty shortly here, but also things like vitamin C deficiency, cavities, like dental cavities, behavior problems, asthma, other upper respiratory infections. It's really putting him at a lot of risk. In addition to that, kids of smokers end up smoking themselves. Do you want him to grow up to be a smoker?
No, but I don't smoke. I've thought about quitting, but it's really hard, so I just don't know how to do it.
Well, now's the time to quit. It's really gotten to the point where you can't keep smoking. Not only for him, like I said, but also for you. You're putting yourself at risk for lung cancer, for emphysema, for oral cancers, for heart disease, for all kinds of things.
I know. I've heard, people have told me before, I've heard all that. I just don't know how to do it. How am I supposed to quit? It's so hard.
Well, there's all kinds of things you can use now. It's not as hard as it used to be. You can use nicotine replacement. There's patches, there's lozenges, there's gum, there's the inhaler, there's nasal spray. We can talk about medications. You can try Chantix, you can try Zyban. There's quit smoking groups you can go to. There's hotlines you can call.
I just don't have time
There's
for
no
any of
reason
that.
why you shouldn't be able to quit. This is really important.
I understand that. I know it is. Everybody has problems, right? It's really, really hard.
Well, what can be more important to you than the health of your child?
I don't know.
I really need you to tell me that you're going to quit smoking. This is really important.
I'll go look at all those things and I'll try to find something and I'll talk to my doctor about it.
Okay, well, I think you really need to think about this seriously. Like I said, it's really putting yourself and your child in danger.
Okay. Whatever. Okay.
Okay.
All right. So how painful was that, right? Man, I watched that and I'm like, come on, just please stop, right? I mean, she's just downloading all this information on her, just, right, smashing it down on her. Totally confrontational, a ton of blaming, right? A lot of guilt, right? Like, come on, what's more important to you than your son, you know? And then again, that information dissemination, like, sure, you know, she's a physician and that's important. She has a huge knowledge base. But in that moment, completely not useful, right? And you can see that by the posturing from mom. You know, she folded her arms and she just, at first she got really defensive, you know. It's like, oh, it's just so hard, come on. And I almost hear her being like, just please try to understand, you know. But she got none of that. And so she tried being defensive. That didn't work. She totally retreated, right? Totally retreated. At the end, that physician was like, I need you to tell me you're going to do something, right? She's like, okay, whatever. Okay. You know, just totally retreated, wasn't going to go there anymore. And, you know, that physician's kind of like, hey, good job. You know, I told them, I set them straight. So, you know, pretty harmful, right? Now let's think about this from a just, I mean, human to human, that's horrible, right? There is no helping there. We chose the helping profession. We want to help people, and that's not at all what was happening there. But let's also look at this from a business perspective. Look, I don't know about your town, but there's a lot of options for physicians in my town. There's a lot of options for counselors in my town. There's a lot of options for dentists and nurses. I mean, there's options, you know. And think about this mom. Is she going back to that physician? I would guess that she's not. And when we conduct ourselves that way at business too, you know, we're going to send our clients across the street because they don't want to have to tolerate us. So that's an example of an ineffective physician, somebody who's very much not within that spirit of motivational interviewing. So now we're going to take a look at the second example. This is like the opportunity for this physician to redeem herself. So here we go. Let's take a look at how she does that.
Watch what happens this time when the provider cues in to what the parent is saying, empathizes with her situation, and attempts to work with the parent to find a solution that fits her needs.
So I wrote a prescription for antibiotics for Aiden.
Okay.
I did want to talk to you, though. I'm a little bit concerned looking through his chart at how many ear infections he's had recently, and I noticed that you had checked the box that someone's smoking in the home, so I was wondering if you can tell me a little more about that.
Well, it's just me and him, and I do smoke. I try really hard not to smoke around him, but I've been smoking for 10 years, except when I was pregnant with him. But it's so stressful being a single mom and having a full-time job, and so that's why I started smoking again.
You have a lot of things going on, and smoking's kind of a way to relax and de-stress.
Yes, yeah. Some people have a glass of wine, I have a cigarette.
Sure. And it sounds like you're trying not to smoke around him. Why'd you make that decision?
I know it's not good for him. I mean, I've read those things about ear infections and asthma and stuff, but other kids have ear infections and their parents don't smoke.
So on the one hand, you're worried about how your smoking might be affecting him, and on the other hand, you're not so sure if it's really the smoking that's causing these problems.
Right, yeah. I mean, he doesn't have asthma. He hasn't had a lot of other problems that his other friends have. So, and I've thought about quitting before in the past, but I just don't see how it's possible right now.
What made you decide to quit smoking when you were pregnant?
Well, he was inside me and we were sharing everything, and I knew that he would get some of that, and I just didn't think I could live with myself if something happened to him.
Right now, though, it feels almost too difficult to even manage or even to try.
Yeah, exactly.
How were you successful when you quit before?
I don't know. I think about it now. I don't even know how I did it. I just did it. You know, I just couldn't imagine like him not being born or going into labor early and him having problems and stuff like that, all the stuff that they talk about with women who smoke. So that was just enough to say, okay, you know what, I'm not going to risk that. So
the risks were so scary then that you're able to stop, but they don't feel as scary to you now.
No, I mean, we're two separate people, and like I said, I try really hard not to smoke around him. I'm pretty good about that. I don't let other people smoke around him. So
You're doing the best you can do.
Yes. Yeah.
Okay, but it sounds to me too like part of you really does want to quit.
Yeah, I know that I need to, and I keep every new year I say, okay, this year I'm going to quit smoking, but then something happens and it just doesn't.
It's on your to-do list. It's just not making it to the top.
Yeah.
If you did decide to quit, on a scale of 1 to 10, where 1 is not at all confident, you don't think you could do it, and 10 is you feel pretty certain that you could, where do you think you fall right now?
Probably like a 5. Kind of in the unsure area. Like, I know I've done it before, so I know I can do it, but at the same time, it just seems really hard, and it's not the same situation.
Well, what made you say 5 rather than 2 or 3?
I know all the ways it's bad for me, and I don't want him to grow up thinking that it's okay to smoke. I don't want him to use any kind of, I don't want him to chew or anything like that. So I know I need to, especially before he gets old enough to understand what mommy's doing, but I just don't know if I can do it.
Okay. So it sounds like you have a lot of reasons why you'd like to quit. You have been successful quitting in the past, and right now you're just feeling a little bit hesitant about your ability to do it.
Yeah.
Where do you think we should go from here?
I don't know. I'd like some help. I just don't know what kind of help I need.
Sure. So. Well, if you'd be interested, that's something I can definitely talk to you about. There are a lot of new options that can actually help people be way more successful in their attempt at quitting. There's different medications you can try.
I don't like medicine.
Okay. There's also a lot of support groups and classes that you can take where you have other people to go through it with you, and sometimes just having that support can be a big part of it, especially for people like you where smoking is such a stress reliever.
That sounds nice, but I'm not sure if I have the time for all that.
Sure. It feels like something that would take up a lot of time and maybe not fit into your life. I wonder if we could talk about some options that might fit into your life.
That would be really nice.
Okay, well, if you're willing, then we could set up another appointment where you could come in and we could talk more about that.
I would like that. That would be great.
Great.
Thank you.
Sure.
All right. So a completely different experience, yeah? So what I want to point out very first for anybody who may be afraid and thinking, look, I don't have time for all this MI stuff. I don't have time to develop this therapeutic relationship. It's fast paced. I got to get going. The difference in time between those two different examples was less than 2 minutes, right? Less than 2 minutes. And think about how effective their follow-up appointment is going to be now that that therapeutic relationship has been established in the second video compared to the first, right? So I personally, for me, I'm not sure. I don't think that motivational interviewing takes more time. It may be an investment more on the front end, but then that helps us be more efficient on the tail end. And so, but I just want to point out that there's really not a big difference. These examples are between 5 and 6 minutes, and you can see how in just a 6-minute example, how that therapeutic relationship can be developed. So, if they did that in 6 minutes and it's a 15-minute medical appointment, they got 9 more minutes to kind of discuss and share and think of ways that they can, or options to help that mom stop smoking. Other things that I think are really good to point out, there was amazing empathy there. The physician was really looking for understanding. She would ask her open-ended questions to help her find that. She did some really nice affirmations to support that self-efficacy. She said, you're doing the best you can right now, right? And the mom was just like, yeah, thank you for validating that. And then, really reflected where she was at and what she was going through. Another thing that I really like that she did is she first asked the mom, where are you at? And what are some of the things that you've tried? How have you done this in the past? And she got that information from her before she then started to disseminate her own information to the mom. So a really good example. I hope that was helpful for you. Oh, one other thing I want to point out. You'll notice how the physician left the door open, right? Like, okay, we're going to come back to this. We're going to revisit this. And the mom was like, yeah, thank you. I'd really like that. So MI is just a super efficient way of helping somebody work through this kind of necessary change in their life, perhaps. So what I'd like to do right now is I would like to go to I'm going to stop sharing this. And I am going to go to the worksheet, okay? And just take a look at your worksheet for Module 2, called 4 Principles. Basically, what you're trying to do here is you want to read the client statement and the therapeutic response, the physician, the clinician, whatever, the professional's response. And then you're going to try to decide which of the 4 principles that is exemplifying. Now, just as a hint here or as a help, the 4 principles are listed right here: expressing empathy, supporting self-efficacy, rolling with resistance, and developing discrepancy. So go through this and read through it and just simply put down which principle you think is being exemplified in each of those different questions. Hold on to that. Remember, you're going to compile that with your other worksheets, and with the exam, you'll submit that for credit. And that wraps up Module 2. I hope you had as much fun as I did. We will see you in the next module.